welcome back to our program, Nurses Share. I'm student nurse Smith, and today my colleagues and I will be sharing on the topic nutrition during pregnancy. Our specific objectives include the definition of nutrition, the importance of proper nutrition during pregnancy, nutrients required for both the mother and fetus during pregnancy, the importance of weight maintenance during pregnancy, food, beverages, and drugs or medications to avoid during pregnancy, and last but not least, complications related to nutrition during pregnancy. Now, first thing first, what is nutrition? Nutrition is a process of how the body takes in and utilizes food and other sources of nutrients. It includes intake, digestion, absorption, metabolism, and elimination. Nutrition is critical for the maintenance, reproduction, growth, development, and critical in disease control. Now my colleagues will introduce themselves and share with you what they have learned.
Hello everyone, Student Nurse Stewie here. Let us talk about the nutritional requirement for pregnant women and or developing fetus. So, generally it is advised that women of childbearing age consume 2,200 calories daily. However, during pregnancy, because there is an increased demand for energy, it is advised that pregnant women up their calorie intake to 300 more than the normal. This is so because if there is not sufficient calories for the body to utilize to make energy, then the next source that will provide energy will be protein. This can lead to ketoacidosis. Let's talk about protein. Generally, it is advised that the regular woman consume 41 grams of proteins daily. However, because there is constant growth and development during pregnancy, it is advised that pregnant women consume 71 grams. Some good sources of protein are poultry, milk, egg, and fish. These are considered complete protein. Why? Because they provide all the essential amino acid needed for growth and development. Calcium and phosphorus is important for the formation of tooth and bone calcification. Hence, it is advised that pregnant women have a daily intake of 1,300 milligrams of calcium and phosphorus daily. Let's move on to another raw material, which is iron. So, in the first 20 weeks, the fetus stores iron in the liver to last for three months of its life when breast milk is typically low in iron. Hence, it is advised that pregnant women consume 27 milligrams of iron each day. Fluoride. It is advised that pregnant women consume 3 milligrams of fluoride daily because this assists in tooth formation. Water. Pregnant women, it is advised that they should consume 6 to 8 glasses of water daily with 3 glasses of milk. This aids in kidney function because she is not only excreting her waste but also that of the fetus. Fiber. Fiber reduces constipation as the increased pressure of the uterus is now on her intestines, which might lead to constipation. Hence, fiber will assist in improved peristalsis. The other important vitamins will be listed in the slides. I thank you.
Hello everybody, my name is Student Nurse Lear and I'll be speaking about the importance of weight maintenance during pregnancy. Now, during pregnancy, at the first trimester, the mother is expected to gain 1 to 4.5 pounds. The recommended amount of weight that it should be gained at the second trimester is 1 to 2 pounds per week, and at the third it is 1 to 2 pounds per week as well. Overall, the total recommended weight gain during a pregnancy for a woman is 25 to 35 pounds. Now, if for example she's above or below this recommended amount of weight gain, this can interfere with the delivery route of the child, the growth of the fetus, as well as the mother is now at risk for complications. A pregnant woman who is obese, though, she's at risk for gestational diabetes as well as gestational hypertension. Gestational hypertension is high blood pressure developed during pregnancy. If not controlled, may lead to preeclampsia. Now, for the gestational diabetes, this is high levels of glucose during pregnancy. However, after pregnancy, she may remain with the diabetes. However, this can interfere with the fetus as he or she may be a larger size than normal, so her body weight, her body size will be larger than the normal child. This may result in the fetus having injured herself while in the womb, as well as the mother is at risk for complications during the delivery process. Other complications that are related to the overweight mother is heart defects, neural tube defects, obesity, diabetes, and high cholesterol. In contrast, the mother may be underweight during pregnancy because she's not having the correct portions of food or having underlying issues. This may cause the fetus to be premature, which is born before 37 weeks. She may have the fetus may have a low birth weight, which is less than 5.5 pounds, or this puts the fetus at risk for developmental problems as they get older. Okay, that's the end of my presentation. Thanks for having me.
Hi guys, I'm student nurse McLean and we're here to talk about some of the food, beverages and drugs to avoid during pregnancy. I just love coffee. But can you believe coffee is one of the products to avoid during pregnancy, as it contains caffeine, and caffeine and caffeinated beverages should be avoided during pregnancy, especially during the first trimester, as it easily crosses the placenta and enters the system of the fetus, and it also acts as a mild diuretic and can cause fluid and nutrient loss, which may lead to miscarriage or low birth rate, etc. How about a glass of vodka? Definitely not. All alcohol and alcoholic products should be avoided during pregnancy, as it readily crosses the placenta and enters the system of the fetus. And we all know that the system of the fetus is not developed, so it cannot detoxify the toxic substance in alcohol and can lead to a wide range of complications with both the fetus and the mother, like miscarriage, stillbirth, physical, behavioral, and intellectual disabilities, amongst others. Other things to avoid during pregnancy include raw or undercooked meat, whether beef, poultry, egg, or seafood, unpasteurized milk and other milk products, as these contain a wide range of bacteria like E. coli, salmonella, listeria, and can cause a lot of foodborne illnesses and may lead to a lot of complications in pregnancy in both the fetus and the mother. Also, certain types of medication like anticoagulant, antiepileptic, contraceptive, opioids, benzodiazepine, steroids, amongst medications to avoid, as these medications have many side effects and can result in a wide range of complications and birth defects in both the developing fetus and the mother. So it is crucial to speak with a medical provider about if an individual is pregnant and considering taking medication or is on medication while pregnant. Thank you guys for having me. That's the end of my presentation.
Hi, good day. My name is student nurse Rachel Christie, and today I'll be speaking to you about the complications during pregnancy with improper nutrition. So first we're going to talk about distorted body images. Like when females have distorted body images, they feel like they're putting on too much weight, so they may develop anorexia nervosa or bulimia nervosa. Anorexia nervosa is an eating disorder characterized by weight loss or lack of appetite, lack of appropriate weight gain, or difficulties maintaining weight for height, age, and stature, while bulimia is a cycle of binge eating and then compensatory behavior such as self-induced vomiting, and this can lead to dehydration, chemical and electrolyte imbalance, and cardiac irregularities. Then we have gestational diabetes. This is diabetes that is developed during pregnancy. It is normally diagnosed within the 24th to the 28th week of pregnancy, and it can be controlled with healthy eating habits and exercise. Sometimes when females have gestational diabetes, they normally have larger babies, or they can have premature birth or stillbirth. Our next is preeclampsia. Preeclampsia is hypertension during pregnancy. So when it's not controlled, it can lead to seizures, strokes, liver or kidney failures. So we all advise mothers who have preeclampsia or signs that they have high blood pressure to limit the amount of sodium intake and to eat healthier. Next we have anemia. Anemia is due to inadequate amount of iron in the body. Iron is used by the body to make hemoglobin, which transports oxygen to the mother and to the baby. So a double proportion is required for maternal and fetal uses. Especially when mothers are near to give birth, they require more iron because they tend to lose a lot of blood during birth, so they have to compensate for the blood that is lost. And then we have hyperemesis gravidarium, which is excessive nausea and vomiting. Excessive nausea and vomiting can lead to chemical and electrolyte imbalance and also dehydration. So we advise mothers with excessive nausea and vomiting to sip their drink or sip their water. They can eat in small proportions. They can drink liquid milk supplements, sip liquid milk supplements so that they can get their nutritional requirements, but yet they're not so easy to vomit. And last but not least is osteomyelitis. This is a softening of bones due to severe vitamin D deficiency. Females who are pregnant require more vitamin D because the baby, the fetus, is developing bones. Hence, we encourage them to eat more foods which are rich in vitamin D.
Hey everyone, thank you for tuning in. We've reached the end of our program, Nurses Share. At this time, we'll be asking a few questions, true and false. So stay tuned and please answer them. Bye guys, thanks for having us. And I'm your host, Abigail Smith.